Some prospective US RNs, they say it's virtually impossible to pass the NCLEX. Maybe you've heard the horror stories, tricky questions, confusing scenarios, and the pressure of getting that passing score. I get it. I've been there. But let me tell you something. It's actually possible. I really passed mine, and that means you can too. In today's episode, I'm breaking down what exactly you really need in order to pass and ace this test. The strategies that work, the mistakes to avoid, and the mindset that will get you through the test. Stay with me, because by the end of this video, you will see that passing the NCLEX is not a dream, it's a reality. Alright, welcome back to my channel, the IELTS DaddY. Let's talk about the pulmonary system. As always, I wish you all the best in your forthcoming NCLEX exam. Wherever you sit for it, all the best. Alright, number one, a client with an upper respiratory infection. We are with the pulmonary system right here. Number one, the client diagnosed with arterial hypertension develops a cold. Which information regarding over-the-counter OTC medications should the nurse teach? What is the right answer? Number one, try to find the medication that will not cause drowsiness. Number two, OTC medications are not as effective as prescription. Number three, OTC medications are more effective than prescription. Number four, do not take OTC medication unless approved by the healthcare provider. What do you guys think? Alright, if we look at the question, arterial hypertension, patient develops a cold. What should the nurse teach about OTCs? Alright, if you look through all the options, the option was number four, that it will prove to you that you are indeed a safe nurse. No patient in such a medical condition, hypertension, should just take any OTC out there. We know very well that OTCs can also cause hypertension. Okay, let's first go through the options. Number one, try to find a medication that will not cause drowsiness. No, the patient should never decide on their own, depending in this circumstance. Number two, OTC medications are not as effective as a prescription. No, yes, they're not as effective as a prescription, but if you compare it to the last answer, takes precedence over this answer. Number three, OTC medications are more expensive. Oh my god, in NCLEX we never care about money. There's no money in NCLEX. Everything is perfect, resources are there, so it's a perfect world. Number four, do not take OTC meds unless approved. Yes, never take them unless approved. Next question. Number two, the client with the flu is prescribed the OTC cough suppressant dextromethorphan. Which information should the nurse teach regarding this medication? Alright, something about dextromethorphan. You have to know your pharmacology. Number one, take the medication every 4 to 8 hours as needed for cough. Number two, take the medication. The medication can cause addiction if taken too long. Number three, do not drive or operate machinery while taking the drug. Number four, do not take a beta blocker while taking this medication. What do you guys think is the answer? Alright, the answer is number one. If we look at this, something about dextromethorphan, what should the nurse teach? Number one, take the medication every 4 to 8 hours as needed for cough. Yes, exactly. This drug has to be taken 4 hourly or 3 times a day, because this is already cough suppressant. So this timing is very correct. Let's first look at the other options. Number two, the medication can cause addiction. Oh, this is not an opioid. Opioids are the ones which often cause addiction. Number 3, do not drive or operate machinery. It doesn't cause drowsiness. Opioids cause drowsiness, and this is not an opioid. Number 4, do not take a beta blocker while taking this medication. Dextromethorphan has no effect on the cardiovascular system, so there's no need to stop the patient from taking any beta blocker. Beta blockers, remember, what they do, what they cause hypotension, they reduce the heart rate. If it was beta 2, then you think about the lungs, of course, causing like bronchoconstriction, but this is beta blocker, so meaning the answer was number 1. Number 3, the HCP prescribed amoxicillin or clavulanate for a client diagnosed with chronic obstructive pulmonary disease, COPD, was cold. Which intervention should the nurse implement? What should the nurse do after the patient is prescribed this? What should they educate? Number 1, discuss the prescription with the HCP because antibiotics do not help viral infections. Number 2, teach the client to take all the antibiotics as ordered. Number 3, encourage the client to seek a second opinion before taking the medication. Number 4, ask the client if he or she is allergic to sulfur drugs or shellfish. What do you guys think is the answer? Alright, the answer is number 2. Very important. Any antibiotics, tell the client to take all the antibiotics as ordered, even if the client feels much better. So literally have to take all the medication, all the amoxicillin that has been given to you. So let's first look at the options. Discuss the prescription with the HCP because antibiotics don't help viral infections. Yes, antibiotics do not help viral infections. Yes, that's very true. They're just used as adjuvants to prevent secondary infection. Number 3, encourage the client to seek a second opinion before why should you seek the second opinion in the HCP as ordered? That's their job. Number 4, ask the client if he or she is allergic to sulfur drugs. No, amoxicillin, these are penicillin, not sulfur derivatives. So the answer was number 2. Okay, number 4, the mother of a teenage girl asks the nurse why her daughter would have many boxes of pseudoephedrine in her room. Which statement is the nurse's best response? Number 1, has your child always had allergy problems? Number 2, teenagers will try to take care of their own problems. Number 3, has your daughter's behavior at school or at home changed recently? Number 4, remove the medication and say nothing to your daughter about it. What do you guys think is the answer? Alright, the mother is wondering why there are so many pseudoephedrine boxes in her daughter's room. What should the nurse reply? So if you look through the options, the answer was number 3. Has your daughter's behavior at school or at home changed recently? The nurse is assessing. Like, you have to dig for more information. Yes, assessment is always number 1. If you happen to look at the nursing the nursing plan, nursing diagnosis always takes precedence. So you have to assessment, DaddY, assess, diagnose, plan, intervene, and then evaluate. So assessment is very, very, very important. Let's first look at the options. Has your child always had allergy problems? Yes, that's more of assessing, but still it's obvious. Pseudoephedrine is an antihistamine, so there was no need to caution about it. Number 2, teenagers will try to take care of their own health problems. Why should they care? Yes, teenagers are becoming independent, but when it comes to health, there's no need to let them care about their own health problems. It's always a good thing for the parent to come in and assist. Number 4, remove the medication and say nothing to your daughter about it. Not teenagers, always collaborate with them. Just don't be dictative to them because they're trying to develop independence. That's growth and development as well, on top of the respiratory pharmacology. So the answer was number 3. Has your daughter's behavior at school or at home changed recently? Because now if Edwin is as well addictive, so you have to pay attention to that. Number 5, the client with the flu has been taking acetylcysteine. Which adverse effect should the nurse assess for? This is a knowledgeable question. Alright. These knowledgeable questions are the ones which first pop up onto the computer on the NCLEX. So that means you have to have your core content. Core content is paramount to the NCLEX. Number 1, bronchospasm. Number 2, nausea. Number 3, fever. Number 4, drowsiness. What do you guys think is the answer? Alright, the answer is number 1. Guys, even if you didn't know the answer, look at all these ones. They sound like side effects. They are not life-threatening. That would have given you clue, even if you know nothing about this acetylcysteine, a mucolytic. So the answer is number 3. Now, acetylcysteine is a mucolytic. That means it affects the bronchos, meaning there's a risk of bronchospasm if used for a long time or in high doses. Number 2, nausea. It's nothing connected to nausea. Fever, no. Drowsiness, this is not an opioid, and drowsiness is often caused by opioids as well as drugs affecting the CNS, the central nervous system. For instance, mental health disorders, drugs. So meaning the answer was number 1. In addition to what I can say, acetylcysteine is also an antidote for acetaminophen. Alright, number 6, which OTC herb should the nurse recommend for a client with a cold who has mild hypertension? Number 1, I want to mention these ones. I'll just say hawthorn. Number 2, ginger. Number 3, garlic. Number 4, golden seal. What do you guys think is the answer? What's the best herb for mild hypertension? What do you guys think is the answer? Alright, the answer is number 3, garlic. Best for cold and mild hypertension, because there were 2 conditions. So number 1, we had hawthorn. Hawthorn is often used for mild hypertension. So, but here we have cold as well, so it won't work for cold. Number 2, ginger. Ginger is often used for digestion issues, nausea, motion sicknesses, for who sit in a car on long distance and they start feeling nauseated. Ginger is best for that. So garlic was the answer. It works both on cold and mild hypertension. Then we also have golden seal. Golden seal affects almost most of the systems. We have the respiratory system, urinary system. So it has to be used in caution when it comes to what? To mild hypertension and cold. Alright, so meaning the answer was number 3, garlic. Both cold and mild hypertension. Alright, number 7, the client who has been using oxymetazoline nasal spray for several weeks reports to the nurse that the spray no longer seems to work to clear the nasal passages. What information should the nurse teach? It's very important to first understand the question. So right here we have no longer seems to work. That means it's like tolerant. Okay, we have number 1, increase the amount of sprays used until the desired effect has been reached. Number 2, this type of medication can cause rebound congestion if used too long. Number 3, alternate the oxymetazoline with a saline nasal spray every 2 hours. Number 4, place the oxymetazoline nasal spray in a vaporizer at night for the best results. What do you guys think is alright? What do you guys think is the answer? So the answer right here was number 2. This type of medication can cause rebound congestion if used too long. First, understand the question. Oxymetazoline. The spray no longer works to clear the nasal passages. What should you inform the client? That it will cause the congestion to get back, which is tolerance, if the patient continues to overuse it. Let's look at the other options. Number 1, increase the amount of sprays used until the desired effect has been reached. No, it's now tolerant, so there is no need to increase, you just causing toxicity. So if we go to number 3, alternate the oxymetazoline with a saline nasal spray every 2 hours. No, there's no need to change the medication. You are not the HCP. Number 4, place the oxymetazoline nasal spray in a vaporizer at night for the best results. No, there's no need to incorporate a vaporizer. This thing is already tolerant. So oxymetazoline right now can easily cause rebound congestion. If you continue to use it, the congestion will instead return. Number 8, which statement is the scientific theory for prescribing zinc preparations for a client with a cold? Why are we using zinc with a patient with a cold? What do you think is the answer? Number 1, zinc binds with a viral particle and reduces the symptoms of a cold. Number 2, zinc decreases the immune response to a virus. Number 3, zinc activates viral receptors in the body's immune system. Number 4, zinc blocks the virus from binding to the epithelial cells of the nose. What do you guys think is the answer? Alright, the answer was number 4. And here they played us some tricks between number 1 and number 4. Let's first look at number 4. Action of zinc on a patient with a cold. Zinc blocks the virus from binding to the epithelial cells of the nose. So whenever it blocks the virus from reaching or affecting the epithelial cells, that means we are relieving the cold. But let's first look at number 1. Zinc binds with a viral particle and reduces the symptoms of the cold. It doesn't bind with the viral, but it just blocks it from reaching. It's like it's a club and then you block people from entering, but you don't bind to them. So that's what zinc does. It just blocks. It's like a barrier. Number 2, zinc decreases the immune response to a virus. Now this is the worst, because the moment you reduce the immune system, then the cold will be exacerbated. You're giving virus an advantage. Number 3, zinc activates viral receptors in the body's immune system. No, it has nothing to do with the virus. It doesn't bind. It only acts as a barrier, which is number 4. Zinc blocks the virus from binding to the epithelial cells of the wall. Number 9, which is our second last. The client diagnosed with the flu is prescribed the cough medication hydrocodone. Which information should the nurse teach the client regarding this medication? Hydrocodone is an opioid. So then now let's see. And an antitussive as well, which means it suppresses cough. Okay, number 1, teach the client to monitor the bowel movements for constipation. Number 2, tell the client that it is fine to drive or operate machinery while taking this medication. Number 3, instruct the client to plan for rest periods, as this medication usually causes insomnia. Number 4, explain that this medication is more effective when taken with a mucolytic. What do you guys think is the answer? Alright, the answer is number 1. This is the best side effect of any opioid, causing constipation. Remember, an opioid, think about this, an opioid causes everything to go down, causes drowsiness, causes respiratory depression, causes constipation. The whole system just goes down with opioids. So this would be the best answer in this scenario. What should they not teach about this medication? Let's first look at the others. Number 2, they tell the client that it is fine to drive or operate machinery. No, I've already said hydrocodone causes drowsiness. So the moment the client is drowsy, there's no need to drive. It's risky and safety is priority on the NCLEX. Number 3, instruct the client to plan for rest periods, as this medication usually causes insomnia. No, this medication doesn't cause insomnia. Insomnia is lack of sleep. It only causes drowsiness, dizziness. Alright, number 4, explain that this medication is more effective when taken with a mucolytic. Now let's first look at this. An antitussive, a hydrocodone, it suppresses the cough. Like it suppresses the mucus from coming out by activating the brain cells that cause the cough, by suppressing the brain cells that cause the cough reflex. Now, mucolytics, on the other hand, they are expectorants. They bring out everything. That means there would now be some antagonistic effect here. So this is not a synergy. It's opposite, meaning the best answer would be number 1. I know people saw bowel movements and they said, how is the bowel connected to the respiratory drug hydrocodone? But remember, in this case, this is a really good side effect. Last but not least, number 10, the nurse on the medical unit is administering morning meds. Which med should the nurse question administering? What should the nurse question? Which one needs clarification? What should the nurse question with the HCP? All this, it's about the looking out for the wrong answer about meds. Number 1, acetylcysteine to a client who is coughing forcefully. Number 2, cephalozolin IV piggyback to a client diagnosed with the flu. Number 3, diphenhydramine to a client who is congested. And then number 4, dextromethorphan to a client with pneumonia. What do you guys think is the answer? Which one is the wrong answer? Which one is the wrong answer? And the rest are correct. So number 1 would alarm us simply because simply because acetylcholine is a mucolytic to a client who is coughing forcefully. Acetylcholine, remember, it has an adverse effect of bronchospasm. So the moment you cough forcefully, it's very easy for the bronchioles to collapse on each other, exacerbating the adverse effect of acetylcysteine, which is bronchospasm. So number 1 would definitely be the answer. Let's first look at the other options. Cephalozolin, which is an antibiotic, is given for someone with flu. Yes, it's given because that's like an adjuvant. Yes, something that will prevent secondary infections, or it's more of a preventative, especially for patients who are going to be hospitalized for long. Number 3, diphenhydramine, which is an antihistamine to a client who is congested. Yes, that's the goal. Number 4, dextromethorphan, which is an antitussive to a client who has pneumonia. Yes, that's fine. Yes, absolutely fine. Anyways, that's why it's paramount to know pharmacology. Anyway, with that said, thank you so much for watching. I hope you've gained something from this video. Please be sure to subscribe and see you in the next videos.